Hi, and welcome to our presentation on umbilical vein cannulation. This is a paramedic level skill which can be found in Rhode Island Statewide EMS Protocol 7.63, Vascular Access Umbilical Vein Cannulation. Indications include primary venous access in a neonate less than or equal to 1 week, requiring access for fluid resuscitation or emergent medication administration. Contraindications include umbilical, peritonitis, and necrotizing enterocolitis. Umbilical is a condition where the intestines, liver, or other organs present outside of the belly button in a thin, transparent sac. Bacterial peritonitis is a bacterial infection which may be caused by intestinal perforations, ruptured umbilicals, or ischemic intestinal necrosis. Necrotizing enterocolitis usually affects the intestines of premature babies. It is a condition in which bacteria may create a hole in the intestines, causing intestinal contents to leak out. So let's get started with our steps. Step 1. Utilize sterile techniques as much as possible, including gown, gloves, drapes, and masks. As always, hand hygiene is very important. Step 2. Double wrap a piece of umbilical tape around the base of the umbilical cord. Step 3. Swab the stump of the cord with a betadine solution swab stick. Step 4. If the stump is not fresh, utilize a number 15 scalpel with a horizontal cut. Cut the cord approximately 1.5 to 2 centimeters from the abdominal base of the cord. Step 5. If the site is bleeding, gently apply tension to the umbilical tape. Step 6. Identify the umbilical vasculature. The umbilical arteries can be found at the 5 and 7 o'clock position, and the umbilical vein can be found at the 12 o'clock position. Step 7. If clots are present, remove them utilizing forceps. Step 8. Utilize forceps to gently dilate the umbilical vein if needed. Step 9. Insert an umbilical vein catheter 3.5 French for premature neonates and 5.0 French for full-term neonates. In accordance with Rhode Island protocol, only insert the cannula until you see blood return. Step 10. Secure the UVC to the umbilicus with tape. Thank you for watching our presentation on umbilical vein cannulation. Hello and welcome to this segment of Pediatric Vascular Access, Intraosseous Needle Placement. Guidance regarding vascular access via the intraosseous route can be found in Rhode Island Statewide EMS Protocol 7.61, Vascular Access, Intraosseous IO. Different services may utilize different brands of intraosseous devices. So which device is the right one for your service? Your choices will span from spring-loaded to manual drill, and the driver. Creators of this presentation have no disclosures. We don't make any money off any of these companies by having their product on this presentation. However, the services where we're at utilize the Teleflex Arrow Easy IO, and that's where we'll focus our attention to this presentation. It is very common in EMS for EMS providers to be employed by more than one EMS service, but you must become proficient with your service's IO access device. EMS practitioners may utilize any IO vascular access device that is approved by the FDA, with the exception of the spring-loaded devices for sternal placement. Teleflex Arrow Easy IO has 3 different size needles. They're all 15 gauge. One's a 15 millimeter, one's a 25 millimeter, and one's a 45 millimeter. Let's take a look at some of the guidance set forth by Rhode Island Statewide EMS. Indications. Patient requiring rapid IV access for medication or fluid administration when regular peripheral IV access is unavailable or secondary access is required in a critically ill or injured patient. Primary vascular access in cardiac arrest when placed superior to the diaphragm. Contraindications include fracture or previous IO access attempt within 24 hours to proposed access site, infection or burn over proposed access site, prosthetic joint at or proximal to the proposed access point, and osteogenesis imperfecta. The Teleflex EZ-IO has 4 recommended insertion sites: proximal humerus, distal femur, proximal tibia, and distal tibia. The general procedure per Rhode Island statewide EMS protocol is as follows. If possible, place the patient in the supine position. If possible, explain the procedure to the patient. Select the appropriate FDA-approved site for insertion. Identify bony and other anatomical landmarks specific to the selected insertion site. Prepare the site with alcohol or chlorhexidine. Insert the device per manufacturer recommended procedure. Confirm proper placement. If patient's awake, you can use the anesthesia 2% lidocaine, adult dose 20 to 50 milligrams, or the pediatric dose 0.5 milligrams per kilogram. Flush the device with 0.9% sodium chloride, 10 milliliters. Secure the device utilizing commercially available stabilizer or a sterile dressing and key. Additional options for securing the IO needle include commercially available devices, cling, or if you're in a jam, you can always use a mask from a bag-out mask. Following the administration of medication, flush with 10 milliliters of IV fluid. A pressure infusion bag may be required for continuous infusions. Vasopressors should be administered via IV infusion pump. The needles utilized in this procedure are quite large and can cause hazard to the patient, provider, or bystanders. Make sure as soon as you pull the needle out, you either stick it in a sharp start or a sharps container. Thank you for viewing this presentation. If you have any questions about intraosseous needle placement or the specific device your service uses, see the manufacturer website for specific instructions on use, or reference the Rhode Island statewide EMS protocols. Thank you.